Welcome to Unit 6, and thank you for sticking with me through this. So, where are we? Well, definition and planning, first phase of managing a project, ended with a plan that we're pretty comfortable with, but we have to admit it's not perfect. Execution is the long fought battle to try to achieve the original intent of the plan, knowing that we're not quite on the plan anymore, and achieving not just the deliverables of a project, the tangible things, but the outcomes, which sometimes aren't tangible. So if we have a project where we want to develop a plan to improve employee satisfaction, we can finish the project, but unless we've improved employee satisfaction, we haven't achieved what we targeted to do. But at some point, the project has to end, and we switch to whatever a normal state would be. And that's what we're going to talk about here. Now, we enter into this phase with success in a pilot, and sometimes more than that. But, at some point in time when we're making changes, we typically like to, for a period of time, switch over and operate into the new world, and then learn from that experience, kind of finalize the new process that we have or whatever the deliverables are, and then switch back and go into a normal state of operations, and the project team disbands, for example. And we are, let's assume that for this point that we've successfully done that. And we have to really have a clear understanding of what additional work is done. Oftentimes, at the end of a project, we realize other things we probably should have done anyways, but for a variety of reasons, maybe can't do them immediately or can't do them the way we would like to right now. And it's really important to kind of capture those things. And then from the pilot, you also tend to have some issues, bugs, if you will, in the system that need to be worked out. And you can transition to a more normal state, but you can't just forget about the bugs in the process that you laid out. And so continuous improvement needs to sort of take over. And the team has learned a lot, and you want to, share that. You want to talk about as a team and individually, be reflective and look at what worked well and what didn't work well. Now, I've seen the transition from the project work to the non-project world, the normal operations, as a time of significant risk. Now, sometimes that's because of what is called the Hawthorne effect, which means the more closely you observe things, you tend to change its behavior. And I've seen projects where in the pilot we did a fantastic job of demonstrating the outcomes, but as soon as we took the attention off of it and it went back to the day to day, a lot of those benefits decayed. And I think that's in part because of the Hawthorne effect. But then also, as a pilot is scaled to other locations or other teams, they get tested, and in transmission, things might be misinterpreted or they may not have been designed well. So, an example is an employee satisfaction project where we asked employees to go through a planning process of talking about what they most liked and disliked in their jobs, and then use that as a discussion platform for discussions with their managers. And when we did it in a pilot, it was wildly successful. But when we asked the rest of the organization, the 90% of the organization that was not involved in the pilot, to replicate that process, we had much poorer results because people didn't execute it the same way they did during the pilot. And frankly, we ended up making employee satisfaction go down when that was the exact opposite effect. So a little war wound from that particular example. And cultures, and every institution has a culture, needs to celebrate success and forgive, but be willing to deliberate on failure. Not every project is going to be successful or may not be fully successful. And, that sets the stage for high performance in the future. And so I've seen organizations of all sizes and shapes who kind of declare success even when there's clear failure. And those cultures really struggle to move forward. And everyone feels better, maybe, but deep down they know that the success that they had targeted wasn't achieved, and it's hard to learn and grow as individuals and as groups when we don't allow ourselves to deliberate on our failures. And the first step of that is really acknowledging them. So let's talk for a bit more on transitioning to normal. We've come up a staircase on the project, and we're almost done. And let's say that our example here will be that we wanted to create a mobile care capability where, we're equipping a vehicle with some healthcare instruments and data collection instruments and things like that so we can serve outlying communities. We get prepared, we go out and conduct a pilot, things go pretty well, but we notice some gaps in the training and the protocols and things that were missing from our supplies. So we fix those things, we go out again and we run a second pilot, and we're really happy with how things are going. And we only have minor issues. Now, the project team that's involved demobilizes at some point. They move on to other things. Some of the project team might, in fact, be the people who staff and are in this mobile care unit going forward, but other people may go back to other jobs, or they may have only been doing this as a part time job, anyways. And as I've mentioned earlier, many projects struggle in these transitions, and good planning with explicit transition steps is really key as well. So again, we're back to planning and we're back to execution of a plan with formalized acceptance. So let's say that for the pilot, the leader of the team that went out to provide the mobile care was a very senior person in the organization. But on a day to day basis, it was going to be less experienced or more junior people in the organization doing it. Well, for us to be able to replicate the success of the pilot, we have to step back and think about what are the things that the senior person in the pilot did or knows that are necessary for the more junior and newer person to do it successfully on a day to day basis. And that's a really explicit transition plan. So, one of the things is conflict resolution. So, more senior people, unfortunately, we tend to deal with more conflicts. And, dealing with a displeased member of the community or something like that requires a lot of skill and tact. And the more junior people who might be doing the job on a day-to-day basis, aren't going to have the benefit of the more senior person's experience. And so, the transition plan to really get ready for normal day-to-day operations requires, addressing issues like that, the knowledge and the skills that are necessary to continue to do the job that we may have supplanted for the pilot, but we need to fill the gap from a long-term operations perspective. So that's the key for making the transition. Now, I'm going to go for a second here into investing in repeatability, which is part of the learning. And the institution can learn, right? We can pass things on. I've already mentioned that we are able to reuse work breakdown structures. And, frankly, the consulting world that I live in wouldn't exist if we couldn't reuse work breakdown structures because we'd be making it up every time from scratch. And I don't think that would be good for anybody. But we also learn in detailed estimating. And the carrot example I made earlier, if I said it took 2 minutes to prep a carrot, and we actually found out during the course of the project that it takes 3 minutes to prep a carrot, for a moment, just believe they're really big carrots or something. We are learning something as part of the process. The next time we have to do a project plan to make dinner, we're going to have a much more accurate estimate of what it takes to prepare carrots and therefore kind of cook the meal. So we're learning that way. And more generally, we're looking at the project plan as a whole. We expect every single line item to have some degree of deviance. It might have been done a little bit earlier or a little bit later. It might have taken more resource. It may have been performed by a different person. It may not have achieved the outcomes that were intended. We can learn from every single line item in the plan. And being able to capture that and reuse that for the organization is very key. I'm going to talk briefly now about value and outcomes. So I mentioned this a couple times, apologize for being repetitive, but the project is not done when the plan is complete. And that is a nice accomplishment. But the project is only done when the goals are achieved. And it's really important for high performing teams to have an outcome orientation and not just execute the plan, but execute the plan because we believe it is going to achieve the outcomes. And we talked in the project initiation definition, the PID, about our definition of success. And the idea is that from each stakeholder, has the desired value been achieved? So in the better patient intake, from the patients and their families, have we, on balance, improved things? Are the intake staff and volunteers enjoying their jobs and feeling more satisfaction in their work? Do the downstream care providers feel like we've integrated well with them and they're getting better information? And the ambulance people, do they know? Is it clear to them how to bring people to our facility that we can take care of, right? Really being able to have both quantitative, meaning numeric, and qualitative, meaning quality, descriptions of how we've met and missed each stakeholder's point of view is critical to assessing the value that a project attained. Now, on economic terms, let's say we wanted to drop the unit cost of a particular service that we're providing in the community, maybe basic inoculations or something like that, and we wanted to go and just be able to do those far more efficiently or something like that. Well, we can quantify an amount of time that we're hoping to save, and we can quantify what that means maybe in dollar costs and things like that. And so sometimes the metrics are really the best ways to measure. But other things, it's not so clear. If you look at patient satisfaction, if a patient is in trauma, they can feel very good about the hospital, but the backdrop is it's still a very negative situation for them. So it's maybe unreasonable for them to, be thrilled with the service they're getting when they're going through some significant trauma. And so you have to have some qualitative interpretation on things when you're looking at the numbers. Management by number is not the way to go. Management without number is also not the way to go. Value sustaining is over time being able to achieve those outcomes repeatedly and maybe improve upon them is very key to this phase of the project and being successful at more projects in the future. And lastly, as I mentioned a couple times, intellectual honesty is really crucial here. Reflection is good for the soul, and we all fail on a regular basis. And it's really important to be a high performing organization to be able to be critical of the activity or critical of the outcome without being critical of the individual. So I'm going to pause here and get ready for the next and last video.